Welcome to the Division of Workers' Compensation Healthcare Provider Bootcamp Series. Today, we're suiting up for a high-intensity training session. You'll be navigating the obstacle course through our Rope Bridge Challenge to master the various provider roles and responsibilities. We'll also be mapping out the expectations for healthcare providers caring for our injured employees. So tighten those laces, keep your balance, and get ready to cross that bridge with a sense of adventure. The learning objectives for today is to learn how your healthcare provider can participate in workers' compensation, knowing the different roles a doctor can participate in, and understanding the responsibilities of each of those providers. As we emphasize in all of our educational presentations, our goal is to inform and educate participants. This presentation is intended for educational purposes only and offers general information. It is the responsibility of system participants to understand and comply with the relevant statutes and rules. These statutes and rules are used when resolving disputes or complaints, so it's essential to familiarize yourself with the Texas Insurance Code, the Texas Labor Code, and the Texas Administrative Code. Within the Texas Workers' Compensation System, there are different roles providers are able to take part in, and depending on which role they serve, each provider has specific responsibilities. Today's presentation will cover the common definitions associated with healthcare provider roles and responsibilities, what the basic qualifications are for participating in the Texas Workers' Compensation System, the roles each of these doctors play in the overall care of injured employees, and the general responsibilities of both doctors and healthcare providers. Before joining DWC, I worked in healthcare. And one thing that I quickly discovered coming into this agency is that many terms I used in the clinic had different meanings in the realm of workers' compensation. For instance, the term healthcare provider in workers' compensation is defined as both individuals and facilities. The term healthcare facility is defined as a hospital, emergency clinic, outpatient clinic, or other facility providing healthcare. And that is similar to their usual definitions. However, the term healthcare practitioner in workers' compensation is unique. It includes both licensed individuals who provide healthcare and non-licensed individuals who offer healthcare services under a doctor's supervision. This nuanced difference highlights the distinct language used within workers' compensation compared to the general healthcare field. You will find these definitions defined under Section 401.011 of the Texas Labor Code. To be part of the workers' compensation system, healthcare practitioners must meet some essential requirements. They must have an active medical license to participate in their jurisdiction, and if they're unlicensed, they must work under a licensed healthcare provider's supervision. In Texas, to participate in the workers' compensation system, practitioners must file a financial disclosure with the Texas Department of Insurance Workers' Compensation Division. Additionally, they must have no disciplinary orders that would restrict their participation in the system. What is the purpose of financial disclosure? Financial disclosure aims to prevent healthcare practitioners from making unnecessary referrals to providers they have a financial interest in. This helps ensure that referrals to any associated entities are appropriate. This also includes any compensation arrangement, and that's defined as any arrangement involving any payment between a healthcare practitioner, or it could also be a member of a healthcare practitioner's immediate family and a healthcare provider. Financial disclosures must be filed with the DWC when a provider refers an injured employee to another provider they have a financial interest in. This must be done within 30 days of the initial referral, unless it was previously disclosed. The division has a web page with more information on financial disclosure, including examples and how to file financial disclosure information within the TexComp system. This is available on the division website under F in the workers' compensation section, that A through Z section. The division has a responsibility to oversee the workers' compensation system. In doing that, they ensure all participants, including healthcare providers, comply with regulations. When any noncompliance is discovered, the division can impose various actions, and this can include restricting providers from treating workers' compensation patients. A list of healthcare providers with restrictions is available on the division website, again, in that A through Z section under D for doctors not treating. Although they may still be able to practice, these restrictions might limit the services that they can provide. One service that may be restricted is being allowed to become a designated doctor. These are the doctors that are specially trained to perform exams and resolve disputes in the workers' compensation system. Some of you out there may remember that our statute previously included an approved doctors list. That was abolished in 2007. Any doctor removed or denied from that list would still be considered sanctioned. I've touched on a few of the roles that doctors can have. These different roles might be a little bit confusing at first for anyone more familiar with general healthcare terms. So let's go further into detail about the specifics of each of these roles. First, there's the treating doctor. This is the doctor who's primarily responsible for coordinating healthcare for an injured employee's compensable injury. You want to think of this doctor as the gatekeeper of the injured employee's treatment. The initial doctor who provides care to an injured employee is considered the employee's initial choice of treating doctor. I say that, but that's not always the case, and I'm going to get into that a little bit further into the presentation. Next, we have the referral doctor. This is the doctor who examines and treats an injured employee at the request of the treating doctor. Then there is the consulting doctor. This is the doctor who examines the injured employee or their medical records in response to a request from the treating doctor, a designated doctor, or it could be requested by the division itself. The designated doctor is assigned and trained by the division to recommend a resolution for disputes regarding the medical condition of an injured employee. This can be requested by the insurance carrier, the injured employee, or ordered by the commissioner. The required medical exam doctor examines the injured employee's medical condition at the request of the insurance carrier or the division. Though in this instance, it's usually the insurance carrier who requests this exam, these doctors provide an unbiased evaluation of an injured employee. And lastly, there is the peer review or utilization doctor. This doctor performs an administrative review at the insurance carrier's request without physically examining the injured employee. The peer reviewer must have no known conflicts of interest with the injured employee or the healthcare provider who rendered the care that they're reviewing. The Texas Labor Code defines a doctor as a licensed and authorized practitioner of medicine, osteopathic medicine, optometry, dentistry, podiatry, or chiropractic. To practice in Texas, they must hold a Texas medical license. While we do know mid-level practitioners like physician's assistants and nurse practitioners can treat injured employees, they do not meet the statute's definition of doctor, so they cannot be officially assigned as treating doctors. There are also a lot of healthcare systems that don't recognize a chiropractor as a doctor, but the Texas Labor Code does recognize chiropractors as doctors, allowing them to serve as treating doctors in our system. We've gone over and defined what each doctor role is. Now let's delve into the responsibilities for each of these providers that are outlined in the Texas Administrative Code 180.22. All healthcare providers in the Texas workers' compensation system must adhere to our rules, statutes, and policies. This includes reporting required information, such as disclosing financial interests and providing unbiased evaluation of injured employees' conditions. Their medical opinions are vital to our system, ensuring that injured employees receive the right care at the right time. And this often involves following treatment guidelines and having important conversations with injured employees about their care. Providers are expected to evaluate each case impartially without bias to maintain the integrity and effectiveness of the workers' compensation system. Healthcare providers should also ensure that they bill correctly by following the medical billing and fee guidelines outlined in Chapter 134. One key task for healthcare providers is to examine injured employees to determine when they've reached maximum medical improvement. This is known as the point at which recovery is as complete as it will get, and the injured employee has reached maximum recovery from their injury. Sometimes this means that the injured employee recovers fully, but other times they may not reach 100% pre-injury status. This is where the impairment rating comes in. The impairment rating is a percentage that reflects the permanent impairment of the whole body resulting from the injury. Additionally, healthcare providers must comply with federal regulations like the Americans with Disabilities Act, ensuring they meet all legal requirements and provide the best care for injured employees. The responsibilities of a treating doctor, referral doctor, or consulting doctor include providing healthcare that is reasonably required to treat work-related injuries. Their role is to ensure that treatment cures or relieves the effects of the injury, promotes the recovery of the injured employee, and enhances the injured employee's ability to return to a productive role in the workplace. Injured employees are entitled to all necessary health care for the duration of their claim, with no cutoff of medical services even after they reach MMI. For claims or injuries that happened before 1991, they fall under old law. And old law allowed for lump sum settlements for medical services. However, for injuries occurring on or after January 1st, 1991, there are no lump sum settlements. Instead, injured employees are entitled to all medically necessary benefits for their compensable injuries. Now that we've covered provider responsibilities, let's discuss the role of the treating doctor. We'll take a closer look specifically at the treating doctor's responsibilities in the Texas workers' compensation system. Injured employees have the right to choose their treating doctor. Typically, the first doctor who provides care becomes the treating doctor. For network claims, injured employees must select from the network's panel of contracted doctors, and those panels may or may not include chiropractors. For more details on choosing a treating doctor, you can check out Texas Administrative Code 126.9 for more information. There are some exceptions to an injured employee's choice of treating doctor. For example, if a doctor is paid by the employer or recommended by the carrier or the employer, this may affect the choice. If the injured employee receives treatment from a recommended doctor for more than 60 days, that doctor can become their treating doctor. Another exception involves emergency room doctors. An ER doctor does not automatically become the treating doctor unless the injured employee continues to receive care from them beyond the follow-up treatment that was related to the ER visit. If the injured employee finds another doctor that is willing to provide treatment as a treating doctor, the injured employee can request a change of treating doctor. This is done using DWC Form 53 and is initiated by the injured employee. This form has to be signed by the new doctor and then needs to be submitted to DWC for approval. The form can be sent to us in a couple of ways. It can be uploaded into TextComp, or it can be faxed and mailed. This form, once it's received, is reviewed, and the request is processed within 10 days. For networks or political subdivisions, and when I say that, I mean things like counties, sheriff's departments, or school districts, they may directly contract with healthcare providers or operate like a network. So please make sure that you check with the network or that political subdivision to see if they have their own form to request a change of treating doctor. The treating doctor is responsible for the overall care of the injured employee, even if they have referred to another doctor. The referral doctor should be communicating back to the treating doctor on a regular basis. The only exception would be in emergency situations. The treating doctor should be approving or recommending all health care. Again, everything goes back to the treating doctor so that they're aware of all the treatment and they can coordinate the overall care that the injured employee is receiving. One of the most critical responsibilities of a treating doctor is to assess and provide a professional opinion on an injured employee's ability to return to work. including any necessary restrictions if they have them. This evaluation is crucial, and the treating doctor must clearly communicate their findings to the injured employee's employer and the insurance carrier through a work status report, adhering to all relevant regulations that go along with this report. This process is essential to keep the process of care moving forward because income benefits are decided based on this communication. And that can have a significant impact on the injured employee's life. The medical opinion of the treating doctor is integral to the mission of the workers' compensation system. The treating doctor is responsible for completing that DWC 73 form known as that work status report. You can bill for this using CPT code 99080 with a modifier 73 and receive reimbursement of $15. Under proper delegation, the treating doctor can have their mid-level complete the work status report. However, even if they delegate this to their mid-level, the treating doctor remains ultimately the one who's responsible for this report. The requirement for the 73 form is detailed in Rule 129.5 of the work status reports. According to the rule, a work status report is not needed for every visit. If you've been billing for a 73 form at every visit, you might have seen that you've been encountering some denials from the insurance carrier. And that's because payment is only authorized when the work status report is required. The work status report is first required during the initial examination by a treating doctor or a referral doctor. It is not necessary for emergency room visits, but once the employee visits a non-ER treating doctor or a delegated mid-level provider, a work status report is required on that first visit. After that, a new report is only needed if there is a change in the injured employee's work status or significant changes have happened in their activity restrictions. The rule also states that the treating doctor will be required to complete a 73 form at the request of the insurance carrier, its agent, or the employer if they request it through their carrier. But this should not exceed more than one report every 2 weeks, and it does need to be based on the doctor's scheduled appointments with the injured employee. The report of medical evaluation, or the DWC 69, is a pivotal form in the workers' compensation system. Though it is not used as frequently as the 73, this form comes into play specifically when the treating doctor needs to determine the maximum medical improvement date for an injured employee. Unlike the 73, there's no separate charge or reimbursement for completing the 69. When an MMI and impairment rating are required, the treating doctor completes this form. There are instances when the treating doctor may not be authorized to assign an impairment rating. In those cases, the treating doctor must decide whether the injured employee has a potential for permanent impairment or not. If so, the treating doctor must then determine if they're qualified to make that assessment or if a referral to a doctor who can make that assessment is necessary. Detailed guidelines for this process can be found in the Texas Administrative Code 130.2. Ultimately, it is the treating doctor's responsibility to establish the MMI and then decide on the next steps regarding the impairment rating, ensuring that the injured employee receives accurate and comprehensive care throughout their recovery journey. If the treating doctor determines that an injured employee has no potential for impairment, they can certify MMI without special training and complete the 69 form with the necessary MMI date information. In cases involving minor injuries where the injured employee is treated and released and is not receiving temporary income benefits, the treating doctor is not obligated to schedule an MMI examination. In those instances, the DWC 69 form may not be necessary, but if an examination for MMI is conducted, the 69 should be completed to meet those submission deadlines. Instructions for completing this process can be found on the second page of the form. If an insurance carrier requests a 69 to certify MMI for a minor injury, The treating doctor can respond to the carrier with the latest clinical notes along with the 73 form for that injured employee's condition, and they're not required to schedule and conduct an MMI examination. This is why clinical documentation is important and should be detailed regarding the mechanism of injury along with pertinent history, exam, and any additional findings. It's crucial to note that once an injured employee has been evaluated and reached MMI, they are entitled to all medically necessary benefits for the duration of the claim. When another doctor assigns an impairment rating or certifies MMI, they must forward the 69 form and any accompanying reports to the treating doctor for their review. The treating doctor is not obligated to conduct a separate examination for the injured employee to determine MMI or the impairment rating. Instead, they're expected to make an informed decision based on their comprehensive knowledge and understanding of that injured employee's condition. If the treating doctor disagrees with the assessment provided by the other doctor, they must provide a detailed explanation to both the division and the injured employee within 7 days of receiving the 69 form. This ensures transparency and clarity in the evaluation process. When a designated doctor needs to provide opinions on MMI and IR or other issues concerning an injured employee, the treating doctor plays a crucial role again. The treating doctor is responsible for sending all relevant medical records in their possession to that designated doctor, ensuring that they have all of the necessary information for a thorough evaluation. Notably, the treating doctor can send these records without requiring a signed release from the injured employee because workers' compensation cases are exempt from HIPAA compliance. The designated doctor is authorized to receive the employee's confidential medical records to help resolve disputes effectively. Additionally, the treating doctor can include any analysis of the injured employee's medical condition, their functional abilities, and those potential return to work opportunities, providing a comprehensive view to aid that designated doctor in their assessment. The designated doctor is required to notify the division within 1 working day of the scheduled examination if they did not receive the required medical records. And upon that notification, the division will take the necessary action to ensure that that designated doctor does receive those records. The treating doctor should be ensuring that the designated doctor receives the medical records no later than 3 days prior to the date of that designated doctor exam. And that is found in Rule 127.10. A treating doctor may bill and be reimbursed for those records from the insurance carrier as well. You can find more information on that under Rule 134.120, and that is for reimbursement for medical documentation. There can be varying opinions on whether an injured employee has reached maximum medical improvement and what their impairment rating should be. In some cases, the insurance carrier might request a designated doctor exam for the injured employee. If the injured employee disagrees with the findings from the designated doctor exam, they have an option to seek an alternate certification as permitted by the statute. The injured employee can request an alternate certification if the designated doctor's opinion is the employee's first evaluation of MMI and IR, and the employee is not satisfied with that designated doctor's opinion. The injured employee can then ask for a reevaluation by the treating doctor or a referral doctor chosen by the treating doctor. This process ensures that the injured employee has an opportunity to obtain a second opinion, promoting fairness and accuracy in the assessment of their medical condition and impairment rating. The treating doctor can also offer an alternate opinion on various other issues, such as extent of injury or the employee's readiness to return to work. The criteria for this alternate opinion is the same. If the treating doctor or a referral doctor hasn't previously given an opinion on the matter, but the designated doctor has, and the injured employee disagrees with the designated doctor's findings, then an alternate opinion can be sought. For more information, you can refer to Texas Labor Code 408.0041, which covers the procedures and regulations for designated doctor examinations. This ensures that the injured employee has multiple avenues for fair and thorough evaluations, promoting a balanced approach to their care and their recovery. When there's a dispute about whether a workplace incident caused an injury or condition, the treating doctor may be asked to provide an opinion on causation. Causation is a medical opinion that outlines how and why the claimed accident or incident significantly contributed to the diagnosed condition that's being treated. A thorough causation analysis should include a brief summary of the examining doctor's qualifications, the injured employee's medical history, any exam findings, and an explanation of how these findings led to the doctor's conclusion. The treating doctor is typically the best person to provide this analysis because they're the ones that are most familiar with injured employees, often having been involved with their treatment from the very beginning. For more detailed information on causation analysis, you can go to our webpage and navigate that workers' compensation A through Z section and go under C to find causation analysis, where there's comprehensive resources available to you on this topic. On our webpage, you will see that there is specific information that treating doctors can reference on how to write a causation statement. I would also suggest that the medical documentation from the first visit explain the causation or mechanism of injury, so that if it's necessary, that medical record could suffice in resolving any disputes regarding this. And then the treating doctor may not have to write a separate narrative. The website does provide you with a sample report and best practices if your treating doctor is preparing one. This is what makes workers' compensation different from private insurance plans. The workers' compensation insurance carrier is only responsible for paying benefits for a compensable injury. There can be a great deal of scrutiny that can surround how the injury or the illness is work-related. Treating doctors should know best, and they should be giving their unbiased opinion on whether the diagnosis, that's being treated is caused by a work incident or not. Sometimes this involves a tough conversation with the injured employee, but that is why we rely on the treating doctor for their expert medical opinion after thorough evaluation and history. That completes the responsibilities of a treating doctor. Let's discuss the other types of doctors in the workers' compensation system and their responsibilities. Referral doctors are specialists who examine and treat injured employees at the request of the treating doctor. It's important for the treating doctor to maintain open communication with the referral doctor. This ensures coordinated and comprehensive care for the injured employee. Referral doctors play a vital role in supplementing the treating doctor's treatment plan, and they should be providing timely and regular updates to the treating doctor, who again is ultimately responsible for overseeing all aspects of the injured employee's care. While there is no official referral form for non-network referrals, while there's no official referral form for non-network referrals, if you are dealing with a network, you want to make sure that you are checking with that specific network's guidelines on referrals. And remember that it is important to document any referral in the medical record. The treating doctor must stay informed about the referral doctor's findings and treatment plans. Additionally, the referral doctor should not refer the injured employee to another specialist without the treating doctor's approval. This helps ensure a cohesive approach to the injured employee's medical care. A consulting doctor can be brought in by the treating doctor, a designated doctor, or through the workers' compensation division to examine the injured employee or review their medical records. This request is typically made to confirm the diagnosis and ensure the appropriateness of the treatment plan. Consulting doctors can assess the injured employee's medical condition, work status, their ability to work, and potential work restrictions. While they have the authority to examine the injured employee and suggest referrals or initiate treatment, they can only do so with the treating doctor's approval. If the treating doctor approves or requests that the consulting doctor provide treatment or healthcare, the consulting doctor then switches roles and transitions into a referral doctor, taking an active role in the injured employee's healthcare management. This collaborative approach ensures that the injured employee receives the most accurate and effective care possible. In our system, designated doctors are appointed by the division to provide expert opinions on disputes regarding an injured employee's medical condition. Their assessments are crucial, and they can even be used in legal proceedings. These doctors undergo specialized training to understand the workers' compensation system and their role and how they affect injured employees. To become a designated doctor, they must complete training and testing and apply to then be included on the division's official list of designated doctors. They are required to update their training every 2 years, although they only need to test once under our new system. With the recent increase in reimbursement rates for maximum medical improvement and impairment rating evaluations, it's now become more accessible and more rewarding to be a designated doctor. Required medical examination doctors are typically chosen by the insurance carrier or in some instances by the division to conduct an impartial evaluation of an injured employee upon request. These evaluations are often sought when there's a dispute or when the insurance carrier wants a second opinion on issues like MMI, the impairment rating, or it could be related to other claim matters. Usually, a designated doctor must conduct the initial examination before an RME can be requested. If an RME is requested before a designated doctor exam has happened, the RME doctor can only assess the appropriateness of care. But if the request is made after a designated doctor exam, the RME doctor can evaluate MMI and IR, disability, return to work status, and other relevant issues. The RME doctor does not make referrals or initiate treatment without the treating doctor's approval. In most cases, the RME doctor is focused on evaluation rather than treatment. If desired, the treating doctor may attend the RME exam if that injured employee would request them to be there and that treating doctor agrees. For more information on RME exams, you can look at Texas Administrative Code 126.6. Peer review or utilization doctors don't conduct in-person exams. Instead, they perform detailed administrative reviews on a prospective concurrent or retrospective basis. Their job is to evaluate the medical necessity and reasonableness of healthcare services, ensuring that the care provided is appropriate and justified. UR doctors review the appropriateness of care, which may occur as part of the utilization review process. They can also be asked by insurance carriers to assess other issues not related to medical necessity. To carry out these reviews, UR doctors must be licensed in Texas and hold the proper credentials. Additionally, they must be registered with the Texas Department of Insurance as part of a recognized utilization review agency. So let's recap what we've talked about today. We covered the common definitions associated with healthcare provider roles and responsibilities, what the basic qualifications are for participating in the Texas workers' compensation system, the roles each of these doctors play in the overall care of injured employees, and the general responsibilities of both healthcare providers and doctors in our system. So let's wrap up this discussion with a fun challenge. We've put together 5 questions based on today's webinar to test how well you've absorbed the material and also to see how good of a job I did at explaining this to you. It's a series of 5 questions. I will put up the poll for you. And if you can't see the first 5, just make sure that you scroll down to answer them. We'll give about a 3-minute window for you to review these and answer them. And then we will go over the answers with you. The first question is, to participate in the Texas workers' compensation system, a healthcare practitioner must disclose financial interests. The answer to that is true, and almost everybody got that correct. Remember that providers need to disclose any financial interests, and they would do that through their TexComp profile. Question number 2. How does a healthcare practitioner disclose financial interests? I already answered that one for you by saying that, and it is correct here. Almost everyone got that with the TexComp profile. Somebody selected carrier pigeon, which we don't offer that service. So we suggest that you do go over to Tax Comp profile and do it there. But it looks like almost everyone got that one right. Number 3, are medical services cut off after an injured employee reaches MMI? The answer to that is no, it is not. Remember, the injured employee receives all medically necessary care for their compensable injury for the life of that claim. So there is no cutoff after maximum medical improvement. Number 4, can a treating doctor that is not authorized examine and assign an impairment rating to an injured employee? Again, a majority of you got that one correct. The answer is no. A treating doctor has to be authorized in order to assign that impairment rating. If they're not able to do that, then they would refer over to a doctor who can. And the last question, designated doctors are assigned by the division and their opinions are used in disputes over the medical condition of an injured employee. The answer to that is true. Designated doctors are assigned by the division and those opinions are and have been used in disputes over the medical condition of an injured employee. Well, it looks like I did pretty well. Everybody got those, a majority of people got those correct. So that's exciting to see. And I'm so glad a majority of you contributed to that because it's fun to see everybody involved in that. That finishes the presentation for healthcare provider roles and responsibilities. At our next boot camp, we will be testing your skills in the EPIC Ring Bar Challenge, where you will learn how to identify a workers' compensation patient. This will cover how to verify workers' compensation coverage and steps to take to minimize missing identifying injured employees as potential workers' compensation patients and hopefully help you reduce your denials. If you have any questions, you can always contact us at Comp Connection by email or phone. And this does conclude the recording of today's topic. So thank you so much for joining us.